स्टूडेंट्स, आज हम बात करेंगे एक और इम्पॉर्टेंट टॉपिक के बारे में जो कि हमारे दो मेन मोस्ट कॉमन फ्रंटल चेस्ट एक्सरे की प्रोजेक्शंस हैं। आज हम बात करेंगे हाउ टू डिफरेंशिएट बिटवीन AP वर्सेस PA चेस्ट रेडियोग्राफ। दिस इज़ द table. We'll come to this table at last. First of all, we'll discuss about the individual projection. ठीक है, तो PA चेस्ट एक्सरे के बारे में हम पहले डिस्कस करते हैं कि वाई PA चेस्ट एक्सरे इज़ टेकन सो ऑफन, वाई इट इज़ सो कॉमन। हमें हमेशा मतलब PA ही क्यों लेते हैं। ठीक है, तो पहली बात हम करते हैं, पहली चीज़ है दैट PA is taken so often because it is the standard technique. ठीक है, because it is the standard technique. Why it is a standard technique? It is a standard technique because it allows because it allows comparison between repeated subsequent chest x-rays. ठीक है, why it is a standard technique? Because it is the PA projection is taken on a fixed distance, fixed position. ठीक है, फिक्स डिस्टेंस से हमारा क्या मतलब बनता है कि यहाँ पे हमारा सोर्स टू इमेज डिस्टेंस जो है SID here is 180 centimeters. It is always taken as 180 centimeters. This is the fixed distance. Second is fixed position. The patient will always face the cassette and the heart will lie close to the cassette, so it will reduce magnification because of the parallel nature of X-ray beam. ठीक है, and the rays will pass from posterior aspect of the patient's body to the anterior aspect of patient's body. What is the other thing that we do is we ask the patient to keep his or her hands on his or her waist. ठीक है, then what will it do? It will allow the patient, the scapula will be rotated outwards. ठीक है, scapula will be rotated outwards. Then what will this scapula will do? If not rotated outwards, it would overlie on the lung fields and obscure them. ठीक है, here we can see that this is the scapular shadow. This scapular shadow is lying well away. It is projected away from the lung fields. ठीक है, second is these are the ribs. These ribs are placed obliquely. These ribs are seen as oblique, in a oblique fashion in a PA chest x-ray. ठीक है, third is inspiration. At last we'll talk about inspiration. One of the reasons why PA is usually taken and why PA is a standard technique is because of inspiration. ठीक है, one was that it was taken on a fixed distance. The other was it was taken on a fixed position. The third is it is taken on deep inspiration. ठीक है, what will this deep inspiration do? This deep inspiration will allow the lungs to expand. It will allow the lungs to expand and better quality. It will give rise to better quality. Okay. Then in some other video, we'll also talk about how to assess inspiration on all of the other factors. Now we'll talk about the AP chest radiograph. Now we'll talk about AP chest radiograph, that what is the difference in the technique of AP radiograph. Okay? Why does it appear different from PA? First of all, the source to image distance SID here is much less than 180 centimeter. So what will it do? It will do this thing. It will lead to divergent X-ray beam. What will this divergent X-ray beam do? It will cause magnification of heart as well as mediastinum. Okay? One more reason for this magnification is the distance between this heart and the detector plate or the imaging plate. Okay? This will cause what? The margins of heart will be like this, and it will result in apparent cardiomegaly. Okay? The next point is technique or position. Okay? We do not usually take AP radiographs. We take AP radiographs only in sick patients who are elderly or not able to stand, etc., or ICU patients or children. Okay? AP is only taken in these people. Why it is taken? Because the patient cannot stand here. So in AP, what we do is we make the patient either sit or lying down, and then we keep the cassette below the patient, and the X-ray beam is kept above with a much lesser source to image distance, and the rays travel from anterior to posterior. Okay? The other point is inspiration. As you all know, we take this AP radiograph in either sitting position or the lying down position. What will it do? It will not allow the patient to fully inspire. Okay? If the patient will not fully inspire, what will it cause? It will cause increase in transverse cardiac diameter, first, and second. Two things it will cause. First, it will cause increase in transverse cardiac diameter and lead to apparent cardiomegaly. The next is, because the patient is not able to fully inspire, then on the lung basis, what we'll see? We'll see the crowding of lung vessels at bases. What will it lead to? What will it lead to? It will mimic these crowding of lung vessels. It will mimic infection. Okay? It will mimic infection. So this was all about the difference in techniques of AP versus PA. ठीक है. Now using these points we'll see that how we will differentiate whether the film given to you is it PA or is it AP. ठीक है. First of all, we'll see the scapular shadow. We'll simultaneously see the x-rays also. ठीक है. Then what we'll do about scapula. ठीक है. Because we ask the patient to keep his or her hands on his waist. So what will it lead to? It will lead to scapular shadow will project away from lung fields in PA radiograph. Whether in AP, scapular shadow will directly overlies lung fields. Then our favorite topic, magnification. Magnification is minimally seen or it is absent on PA radiograph, whereas it is significant on AP radiograph. ठीक है. Next we'll come to orientation of the ribs. Ribs will be oriented obliquely in PA radiograph and horizontal or in a parallel fashion on AP radiograph. ठीक है. I'll explain these points one by one. Then we'll come to clavicle. Clavicle is, as you can see here, because the patient is standing in PA na, so clavicle will be directly seen overlying the lung fields. ठीक है. And in AP it will be seen above the lung fields. It will not project onto these apex of lung field na. Next is, we'll write this, clavicle seen overlying apex of lung. ठीक है. Above apex in AP. ठीक है. Next is image blurring. As we know, source to image distance is more in PA. What will it lead to? It will lead to decreased exposure and reduced blurring. Whereas because of reduced source to image distance, क्योंकि वो जो एक्सरे बीम है वो नियर से पास कर रही है, so it will lead to increased exposure. And what will it cause? It will cause blurring of image. Comparatively, it will cause more blurring of image as compared to PA radiograph. Last, we'll come to inspiratory effort. As we have discussed, we acquire PA chest X-ray in standing position, so patient can have good inspiratory effort. Whereas in AP, because the patient is either in sitting position or in lying down position, the patient is going to have poor inspiratory effort. Now we'll see these points one by one. First of all, inspiratory effort is good. Scapula is seen projecting away from the lung fields. The clavicles are more so in a oblique fashion. Sorry, the ribs are in a oblique fashion. The clavicle is seen overlying the apex of the heart. No cardiomegaly is seen. Okay? And reduced blurring. Okay? Now, we'll come to this. We'll come to AP. In AP, as you all can see, inspiratory effort is poor. Scapula, this is the margin of scapula. Sorry, this is the margin of scapula. This is the margin of the scapula. It is seen overlying the lung fields. The clavicles are seen above the lung fields, not overlying the apex, away from the lung fields, you can say. The ribs are in a horizontal fashion, or you can say in a parallel fashion. Our favorite point, apparent cardiomegaly is seen in AP radiograph. I think we have discussed all of the points. And last, I forgot, image blur. Image blurring is seen in AP radiograph, and the reason for that is that the beam is passing from a near distance, because we are having short image to source distance here. Thank you for watching.